here with Rachel Roy, and we're at Dr. Pousson's office with the Pousson Family Dentistry, and we're going to be talking about good home health care for your teeth and mouth. And Rachel, it's nice to have you here.
Thank you for having me, Dr.
Thank you. And you've been here 8 years.
Yes, sir.
Goes quick though, doesn't it?
It really does.
So you were only like 13 when you started.
12, yeah. No, I was 17. I did this in lieu of college.
Did you really? Good for you.
I did, yeah.
I didn't know that.
Yeah, fun fact.
Wonderful. Well, we're going to be talking about good dental care, and in a perfect world, brushing your teeth and flossing your teeth makes up
all you need for
all you
perfect
need.
teeth. Yeah.
But what happens for people that don't live in a perfect world?
Well, for the rest of us, everybody not in a perfect world, it's you have to consider your diet. You have to consider genetics are definitely a factor. You know, you have some people
born with good teeth. Yeah.
Born with good teeth. Some people have naturally stronger teeth, which I hear that in spouses a lot. Like when one spouse comes in and says, I brush and floss constantly, I watch what I eat, and I always have cavities. And my spouse drinks soft drinks all day and never picks up a toothbrush, and their teeth are perfect. And it's like, it's usually not quite that dramatic, but yeah, no. There's definitely a genetic factor, but diet is usually a bigger issue.
I was born with good teeth, and it was the luck of the draw. I don't know why,
Yeah.
but I did standard care, brushing and flossing, and
Yeah.
it's been good for me. But we're going to talk about some other things besides just brushing and flossing. We're going to be talking about how diet affects our bodies, and right now, you know, soda, soft drinks, it's everywhere. And
It's an addiction.
Yeah, it is.
It's in fact an addiction. I've got a couple of friends, like I've been following their journey as they're trying to break free from this. And I mean, it's you know, you got sugar giving you that high.
Sure.
You got caffeine, which I'm a coffee addict, and
Me
my
too.
coworkers will
coffee.
tell you I need
Yep.
my coffee.
Yep.
Yeah.
And it's probably a lot healthier for you than sugar-loaded soft drink.
Definitely. Well, coffee's not as acidic.
So what does a soda do to your teeth?
Think battery acid, but on your teeth.
Oh.
It's not quite that strong, but you know, normally you don't put battery acid on your teeth, but people will have soft drinks all day long.
I was reading an article that you wrote, and it said that soft drinks with sugar in them can dissolve an eggshell.
Yes.
So my thinking is if it can
Yes.
dissolve an eggshell, it can probably do a job on your enamel.
Yes, it can. And the thing is, enamel is the hardest substance in your body. So once you dissolve the enamel, then you get to the dentin, which is considerably softer, and from the dentin to the nerve, and you know, once you hit the nerve, you've got a toothache. And yeah, not fun. So, you know, you kind of want to protect the enamel.
Wow, time for a visit to the dentist. So lay off the sugar-laden soft drinks and go light on the coffee anyhow. So let's talk about, besides the soft drinks and the fact that they can dissolve our enamel, and then go down to the...
Sports drinks are a surprising culprit because they're also acidic. So like, it's one of those things, if you have it once in a while, you have one after practice or something, you're probably fine. But people who drink nothing but sports drinks, they're probably going to wind up dissolving the enamel in their teeth.
So sugar is one problem.
Sugar's one problem.
Acidity is another.
Yes.
And there must be other things that are acidic besides soft drinks.
Citrus. We've had patients come in complaining of sensitivity, and when we talk to them, we find out one lady was eating, it's like 6 grapefruit a day or something. And yeah, she was dissolving her teeth, and like the exposed root surfaces were getting very sensitive.
It's almost a common thing now too with the grapefruit diet and the trend toward vegetarianism, and a lot of people just do the fruit with the blenders, and I could see all that acid being tough on.
I mean, it's not that we want people to give up healthier diets, but you know, introducing more water is always a good thing. Fluoride treatments at the dental office, and you know, in some cases, maybe cutting back on the citrus a little bit would be advisable.
Idea.
Yeah.
So we'll remember that citrus is acidic, diet sodas are acidic, sometimes as acidic as vinegar, and sport drinks, although they are healthy because they're smaller doses of sugar, they have a high amount of acid in them as well.
Yes.
So,
Yes, they do.
and millions of people are doing the citrus and the sodas and the sugar, and I wasn't a big soda drinker. I do like fruit juice. I don't do it a lot, but some people make that a lifestyle, and I would imagine over time they might not notice it in a year, but
Sometimes it's several years, you know, and there's some of the more dramatic things we've seen. We've seen a patient 1 year and we get them back a year later, you know, something happened and they weren't able to come into the office, and a year later they've started drinking soft drinks and their teeth are just drastically different, like much more decay. And other times it takes more time, you know, you gotta wear through that enamel. So it can take time.
Can the dentist do anything once that happens?
Yeah. You can do, you've got the option of like dental crowns, dental fillings, but usually you're looking at a full mouth rehab.
Wow.
You're looking at some fairly drastic dentistry to correct this.
So don't do it.
Don't
do it.
Yeah, drop the soft drinks.
So
Yeah.
we've talked about sugar drinks and healthy care. Let's just go into if you're at home and you're brushing your teeth, you want to brush after every meal ideally. Some people can't do it, only once in the morning and once at night if they're working during the day. Is there a good way to brush teeth really, or is it just you put a
No,
toothbrush
there absolutely, oh, no, there is absolutely a way to brush your teeth. Like we've seen patients who most of their mouth is pretty clean and there's a couple areas that they miss because they don't know how to brush. Now your teeth have 5 surfaces. You've got like the outside, the top of your mouth, and the inside, and then you've got in between your teeth where they touch each other. So when we tell patients how to brush their teeth, we always recommend like they angle it toward the gum line because you want to clean your gums as well as your teeth. You want to brush the outside of your teeth, brush the top of your teeth, and then brush the inside of your teeth. You do top teeth and then bottom teeth. So I mean you're basically going around your mouth 3 times.
And that's like the brush on a 45-degree
Yeah.
angle, is that what you're
ideal.
saying with being, so it should touch the gum line and the tooth? Wow.
Yeah,
And what about flossing? Is there a right way to floss?
very definitely.
Really?
No, we see a lot of patients who come in, they say, I floss every single day, and then we floss and they've got gingivitis or they've got gum disease going on because they're not flossing correctly. Like a lot of people like those floss picks, but the problem with those is they hold the floss straight. The way to floss is to hug the tooth so it slides down under the gum line. And you want to like hug and scrape the side of the tooth a couple of times, then pull it the other way, scrape the other side of the other tooth. And you do that all around the mouth.
And that gets the bacteria off of the tooth as well as the food under the gum line?
Yeah, food,
Wonderful.
plaque, and bacteria.
Great.
Yeah.
So what about mouthwash? Let's let that be our last topic. And is there a good mouthwash, or you don't have to give a brand, but is there a way to do a mouthwash, or is there?
I personally don't really have a strong opinion on mouthwash. I
Just
say anything ADA approved is what you want. I think most ADA approved products have fluoride, which helps strengthen your teeth. It can help boost your enamel, and if you've got exposed root surfaces, it can help to protect the dentin. So fluoride is an extremely good product.
So should you gargle with mouthwash every day? Is that enough or too much? Or
I'd say maybe once a day. I personally do that right after lunch every day.
good.
My
Good.
thing.
Well, I thank you so much. This has been a 3-minute video with the Pousson Family Dental Clinic here in Slidell. We've been here with Rachel Roy, and I thank you so much, and we will see you the next time.
Sounds good. Thank you, Dr.
Rachel.
Jerry.